On November 20, 2009, the global community will commemorate the 20th anniversary of the adoption of the Convention on the Rights of the Child. Sierra Leone adopted the convention, otherwise known as the CRC, in 1990. In further effort to pledge its commitment to children, the country passed the Child Rights Act in 2007, which is billed as a domesticated version of the convention. In spite of the apparent legislative and policy gains achieved over the years, the children of Sierra Leone continue to face disparities, inequalities, and violations that undermine their childhood. Sierra Leone has consistently been ranked at the bottom of the UNDP Human Development Index for most of the decade. The rate at which women die at childbirth and the rate at which children die before they reach their 5th birthday is also said to be among the highest in the world. Mahimbo Indoi is the UNICEF representative in Sierra Leone. He describes the challenges facing children.
Well, as you know, the indicators for maternal mortality and maternal mortality in Sierra Leone are some of the highest in the world, if not the highest. We've seen some slight improvements, but the figures are still quite bad. And we should not be satisfied until at least we reach the MDG levels in terms of maternal mortality and child mortality. Having said that, I think the challenge here is basically, today I was with the President and the Vice President, and we launched the Health Strategic Plan. And as you know, there's also a number of plans that have been launched in education and other social sectors. I think the challenge will be to implement them. This is the thing. I mean, as they say in children's rights, you can write all the beautiful legislation that you want, but if it's not enforced, it doesn't mean anything. So I'd say the biggest challenge is to make sure that UNICEF, the UN, and the government and other development partners are up to the task of putting these plans into action.
So what is the government's policy on reproductive and child health? We have come to the UE building, which houses most government ministries, to meet Dr. Samuel Kagbo, who is the director of the Reproductive and Child Health Program in the Ministry of Health and Sanitation.
The policy for reproductive health actually focuses on the prevention of the excessive mortality of women as related to pregnancy and childbirth, and also the promotion of health of why not even the women within childbearing age.
But how is government implementing this policy and other commitments made to the children in the Child Rights Act and the CRC? We have come to the country's biggest and supposedly best maternity hospital, the Cottage Hospital, otherwise known as the PCMH, to start our investigation. Aisata is one happy mother. She delivered a healthy baby girl a day before we met her, her first. We are told she had a normal delivery. She has been keeping in regular touch with her gynecologist throughout her pregnancy. Not all the mothers and children here at the PCMH are that lucky. These challenges are even more acute in the rural areas, often characterized by lack of information and access. How challenged is the health system in the country? Dr. Anthony Sandi is the Director of Human Resources in the Ministry of Health and Sanitation. He says the staffing situation is always the critical challenge facing the country.
We are talking about effective and efficient service delivery within the health sector. But we have to realize that this is something that is not and never going to be possible without having the adequate amount of trained personnel, well-managed and well-motivated people in place. Now, as you talk about human resources for health within the health sector in this country, especially within the Ministry of Health and Sanitation, it is no doubt that we have a critical shortage at all levels of all categories of staff. For instance, quite recently, we did our staffing needs requirement, and it came out clearly that we need, for instance, 534 medical officers to do an efficient job in this country within the health sector. But as at now, we have barely 128 doctors.
But what is the role of UNICEF in salvaging this situation?
Roughly about 70% of our funds come from UNICEF national committees. At this moment here, we have the UNICEF National Committee for Iceland visiting, for example. This has given UNICEF a lot of independence in terms of what it wants to achieve here with the government for children. Then we also have a coordinating role. We work with the Ministry of Education and the Ministry of Health in coordinating the health and education sector committees. This also helps us, maybe not in terms of what UNICEF receives directly, but it also helps us leverage funds for children. So on our role as the coordination for health and education, we're able to influence donors furthermore to be able to put assistance forward for children in the areas of health and education.